All right, friends, hello again and welcome to the RSV mini-series with Dr. Brent and Coco. In this series, we are working through the specific nuances of bronchiolitis. In previous videos, we've reviewed some basics about what bronchiolitis is, what causes it, and how it's spread, and the symptoms it causes, both dangerous and the ones which aren't so worrisome. Today, I wanted to run down a list of things to expect if you bring your child in for evaluation. My goal here is to make an attempt to avoid frustrations by letting you know what we usually do in these situations and why. So let's pretend your little one is sick. The symptoms have persisted for 3 days and are now getting a little worse. You've done so much for them already at home, but you're ready to take them in for evaluation. Great, we're here to help. Now, the best place to start is with your child's primary care physician's office. But let's be serious here. Kids are never sick when doctor's offices are open, right? It's always at night or on weekends or holidays. So if clinic is closed, the next stop is convenient care or urgent care or whatever it's called in your area. If both of them are closed and you can't wait until they're open again, the emergency department is your best option. And that's okay. Someone will always see your child if they're sick. Again, we're here to help. We start with documenting vital signs and then get you comfy in the room. We gather the reason you've come in and a few lines of background information. Then ask for more of the story. What's going on? When did it all start? Tell us more about it. Then we do a physical exam. Of these, the history that we gather from you is the most important part. In fact, that is actually true for almost every medical encounter you'll ever have. Next would be the physical exam. In the guidelines that the American Academy of Pediatrics most recently released about how we should evaluate, diagnose, and treat children with bronchiolitis, they encourage us to use our eyes and our ears to drive our evaluation and the decisions we make. In this age of modern medicine and easy Googleability, there are a lot of expectations placed on medical providers at every level for every condition for every patient. I would encourage everyone to let go of these because they can be a source of friction and frustration. Does that mean you shouldn't ever ask why? Absolutely not. If something doesn't make sense to you, most medical providers are happy to help you understand. Most of us actually love to teach and jump at the opportunity. Now, there's no way I can speak for everyone here, and I'm biased because that's actually a part of my job that brings me great joy. So just remember that individual results may vary here. But getting back to expectations. You may be expecting that your child's blood will be drawn, urine collected, x-rays taken, swabs done, breathing treatments, antibiotics, and more. Hang with me now, because I might be able to blow some of your minds. Those guidelines I talked about from the American Academy of Pediatrics just a minute ago, those guidelines tell us that if we diagnose a child with bronchiolitis using our ears and our eyes, we should stop there. No labs, no x-rays, no nebs, no prescriptions. You get the idea. However, that doesn't always feel right to parents. I mean, I tend to blame George Clooney and Ellen Pompeo and Patrick Dempsey for that because for all of you who ever watched an episode of ER, Grey's Anatomy, or any other medical show, it may feel like your experience is a little anticlimactic. Now, the provider you see may feel there's a reason to order one or more things that I listed above that we aren't really supposed to do. And that's okay too, because they are turning on their education, their training, their experience to make those decisions based on your child's clinical condition. Just know that if we diagnose your child after just listening to your story and doing a physical exam, that it was because that was all the information we needed. To translate, it means you did a great job of telling us a thorough story, and our physical exam of your child filled in the rest. Now, all of this is bound to stir up questions to put those in, so put those in the comments and I'll do my best to help. That's about all the time we have for today's video, but let's take some time in one of the upcoming sessions to talk about treatments for bronchiolitis, and even better, how we'd like your help in preventing it. Until then, enjoy some Christmas movies and finish those Thanksgiving leftovers, you animals. Actually, If you still have Thanksgiving leftovers, it might be time to let those go. I don't know. They don't put expiration date on most of them, so just use your best judgment, you animals. I'll see you next time.